you, Dr. Vaishnavi. Good evening, good afternoon, and good morning. This is the 1629th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SADAT SAIT. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, and the second session of the day has already come from 8:30, and it will end up at 9:30. That is the international session in English, and we have a local language session from 9:30 to 10:30. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again, and you can subscribe the same without paying any money, and you can share it with your friends, and not only the homeopathic doctors, students, but with homeopathic lovers also. The purpose of this forum is to take homeopathy to the world, to each and every house in around the world, in and around the world. And today, as you know, our guest is Dr. SADAT SAIT. As you all know him very well, because he is a person who has taken sessions in all form of our forum, that is in Hindi as well as in Malayalam, and as usual, the English session also. So a person from Kerala settled in Cochin and is running a clinic by SAIT Homeopathy in Cochin as well as in Aluva. And both the clinics are going in a good way, and he is having lot of online patients also from different part of the world. And he is a person who is fully dedicated his sessions for homeopathy. He is doing lot of wonderful cases, and he is a success. He has made success in different type of cases, as we have seen some of his cases in dermatology, respiratory distress, and at the time of COVID also, he was a person running with a lot of cases, particularly advanced pathology. He has treated advanced pathology, so many advanced pathological cases. He has done so many medical camps as well as our public awareness classes. Not only that, he is one of the most wanted faculty in homeopathic doctors in associations. Particularly, he is one of the faculty at the institution of homeopaths, one of the largest medical organization for homeopathic doctors in Kerala. And he has worked as General Secretary of QFA, that is the Qualified Homeopathic Medical Practitioners in Kerala, as well as he was one of the General Secretary, Joint Secretary of ISK. And all these position he has done justice, and he is still working hard to take homeopathy in a to all. He is ready to share his knowledge. He never hide anything. That is the peculiarity of Dr. SADAT SAIT. And today, Doctor will be discussing about management of ADHD and learning disabilities with homeopathy. So we proudly welcome Dr. SADAT SAIT to the session. Welcome, Doctor.
Can you hear me? Yeah.
Yes.
Can you hear me?
Yes, yes, yes.
Okay. Thank you, sir. Thank you, Dr. Dinesh, for the lovely introduction. I don't know whether I deserve that,
Yes,
but let's give it a try. Okay. Today we'll directly we have just 55 minutes. Okay. We'll just go directly to the topic. My topic today is learning disability. How homeopaths are going to deal with it. How are we going to take the case to a different level? What all things we should uh, can see all that, no?
Yes, yes, it is visible, visible.
Oh. Okay, let me start with the learning disability. Uh, I will be skipping all the theory part of it because it doesn't make any difference for you. You can read up everywhere. So theory part of the learning disability, how things are working out, everything can be whatever necessary things I will discuss it. Rest you can because a lot of theory comes in with the learning disabilities. How the brain learns, all that is not required for this level of interaction. Because all the doctors they know all that. This is for a different levels. We take classes from the school level to the teachers training centers. So we require all this. So we just compile it and keep it. Okay, how do we start the relationship with the ADHD or learning disability? It depends upon how the kids comes to the clinic, right? It's a practical. When the kid comes to the clinic, parents starts explaining it to you. This is this. This is this. They will come and complain that okay, my kid is not studying. Marks are bad. This is the second thing. This is the only few things they start complaining. The school teacher is telling him to shift the school, or school is he is not getting marks. Competition is there. He is not learning. He is not interested in learning. He is not getting marks. This is the only complaint we start getting it, right? So once the patient comes in, making comfortable, what I do in my clinic is to how to start managing the kid. That's the first and foremost thing is make him comfortable. Okay, I start giving some globules. I make them sing a song. I talk to the kid and make them friendly with the kid. Okay, then I ask the kid or someone who is not a 7 years or 8 years to go out and sit. And I make my staff to take care of him or her. We give globules as a sweets. We tell them the chocolates, take the chocolates and go and sit there. So 1 gram pills will be given, or number 60 globules will be given to get the patient used to the medicines and get comfortable with us. Because any globule, sweets, chocolates given to the kid, that will make you the rapport much, much, much better. And in the beginning, I just wanted to tell you is that if you don't have patience, if you are if you are not willing to listen to the parents, it takes time because here parents worry is the most important thing. Okay, we have to start talking to the kids, to the parents. Once case taking is the most important thing. Case taking with the kid is the most important. Kid and the family is most important thing. Talk to the mother first. She will come and explain it to you. What is a kid all about? What is his nature? What does he do? How does he react at home? How does he react to school? How does he have friends? How does he deal with the school? Does he sit in the class? Does he how does he write? All the details one by one, we can collect it because that they will become a tape recorder. They will become because every kid, my kid is very precious for me. And more than a problem, they don't know what is happening with the kid. Only thing they know is that he is not studying. Okay, he is not scoring mark as the other kids. Doesn't that mean that if he is not scoring the mark, that doesn't that mean that he is a dumb child or a mediocre child or a what are called uh, with a lot of issues? The child doesn't have any issues other than the learning disability. He might remember all the things what he studied and what he learned or what he saw in the theater or wherever he went, movie, relatives, friends, whatever you ask, the kid will remember, except for what he has to study for the class or the maths or the English or any subject, whatever it is. So how do we differentiate? We start asking the questions. We will ask, okay, which subject is bad? Okay, so he will explain either bad in the maths or in the geography or in the history or in the language. So we are getting the basic instructions. This is patient has a dyscalculia if it is depending on the maths. If it is other things, language problems. So we will have to take care of the each and every point the parents are telling. We have to ask them what is the basic behavior of the kid. You have to ask them from the history of the family. So start with the kid, then directly go into the family to find out whether the any strong miasm is there. So in the family, you should ask about the parents' health issues, whether what are the parents' characters, parents' behaviors, grandparents' behavior, how does they relate with the kid? Because in my in at sometimes what happens is grandparents are more protective. They become, if it doesn't study, it's okay. Don't shout at the kid. Don't tell the kids to study. They will be overprotective because every house, the more than a parent, grandparents have become the pet. The grandchild has become the pet of the grandparents because that is how the thing goes on, right? Parents, because mother doesn't have a right to shout, mother doesn't have any voice to tell, even husband doesn't agree with the kid, with the wife. So a lot of issues goes on. Then husband and wife issues, husband and what is the character of the husband as per the wife. So all these matters relate to the kid, because kids also will be taking it as an advantage. Okay, if the mother shouts at, he or she comes and tells the father, and father shouts at the mother, or he goes to the grandfather, grandmother. And everywhere, as in Indian culture, uh, daughter-in-laws are always 90% of the houses, daughter-in-laws have the doesn't have that kind of a right. Most of the houses, the grandparents are there, grandparents are there. So all the right, it is his son. Okay, we I don't know whether you people know that we say that the Garka Chirag means he's the if the kid is the only child, then finished, or that family. So he becomes a very precious child. So all the details, every detail has to be asked from this one. Whether the grandparents had any issues, psychiatric problems, or any health issues, if the cancer is there, so anything which can leads to the miasm of the family, miasm which turns into the miasm of the kids. Then maternal side, paternal side, health issues, and how the relationship with the husband and wife. Whether the husband is an alcoholic, if the grandfather is an alcoholic, what is the situations of the house. So every little thing is important in taking the case. Then come to the kid. Then a kid, how does he behave? What is his tantrums? Does he ask for something which we don't give? Lot of symptoms. You collect the symptoms. Don't start interpreting and make the things worse. Collect all your symptoms from head to toe, his physical generals, mental generals. How is his behavior with the teachers, friends, students? Does he use any other narcotics? Does he have any good friends? Does he communicate with the friends? Which subject is he bad? How is his habit of writing is there? Does he write or only read? Or he does just mug up? Does he do the rationalizing the things? How does he pronounce things? Because at times the kids have become too pampered. So one word, what he says, that if you don't correct him, he doesn't register. So over the months, he thinks that okay, whatever he said is right. So his pronunciations, does it do the proper way? How does the parents treat them? So theoretically, yes, causation of the learning disability. Causation, we know that most of the a lot of developments and nutrition neutrons. Okay, emotion strengthen the memory. All that is, we know that cerebral bodies. I'm not going into the detail, but little things which will help you refresh. Does he remember the things? Memory. How often he's been remembered? Is he interested in writing? Is he interested in sitting one place? How does he behave? Because my own brother, he never used to sit with the teachers. He used to just get into excuses and moves on. We should know what is the 7 learning styles. Visual. Prefer using the pictures, images, spatial understanding. Certain kids only do this, not with the writings or any other way of talking or something. You give this one, they will understand. But how long you can do that? It's not easy when the kid starts growing up, first standard, second standard, third standard, LKG, UKG. You can do that. But once the kid grows up, learning with the only with the pictures is not going to help you. So oral, auditory, prefer using sound and music. See, why I'm saying is that these are all the tools to make the kids learn, but add on with the other things. So if you don't understand this, then managing a kid is not easy, because we have to manage the kid the easier way first, then bring on with the tougher way for him. Okay, so verbal, if he's interested in understanding the verbal way, that is reading, talking. So words, prefer using words both in speech and writing. It's not that speech and writing, words he talks. Okay, physical, prefer using body, hand, gestures. Okay, sense of touch. Logical, certain kids learn only with, if he says this is elephant, then he will start asking why the elephant is black, why the tusk is white, why this, why that, how can you say it's why elephant, how did that name come? It was one of the toughest time. We have to keep rationalizing, we have to keep explaining, we have to keep logic and reasonings. Social, prefer to learn in groups or with other people. Combined study, or 5 or 6 kids sit together and learn. Okay, that is called rationing, and that is one way of improving his leadership qualities. Okay, certain kids learn only when they are alone, without disturbance, without talking to them, without giving space for others. So these are the different styles. So we should understand where the kid is of this style or that style. Okay. Oral, which side is this one? Temporal lobe handles. That is all practical and theory. I'm not going into that, because that's not the point of things. This is a management with the homeopathy. So, but we should be knowing all this. Why I will tell you why. Okay. Why this is more important? Learning this one. Parts of the brain that affects the learnings. Okay. Why this has become little more important for homeopathy is that so much of important at times. Yes, we know where the medicine affects, which part of the lobe of the brain does has that sphere of action more. So once when we select the medicines, we if we can get the medicines which affects this temporal lobe, then the medicine becomes the action of the medicine becomes faster. Okay, auditory muscles. Auditory muscles is temporal lobe, ear. It goes into the temporal lobe. So auditory nerve becomes more important. If we select the medicines and after symptom wise, and if that medicine also covers this sphere of action, the medicines become more specific and medicine become easier to and faster the results are. So verbal, temporal and frontal, physical, cerebellum. Okay, we have a lot of medicine acts on the cerebellum. So at times these are more important for the homeopathy also. That is why I'm telling you certain things we need to find out where this is important. Parietal lobes, especially of the left side. Okay, social interpersonal relation, frontal and temporal lobes. We have medicines which affects the frontal lobes. Okay, limbic side, solitary, frontal and this one. So each way of learning is predominant on the lobes of the brain. So each lobe has a special learning abilities. Okay. Then this one comes up, no? Dyslexia, dyscalculia, dysgraphia, dyspraxia, dysphasia, all that is there. That is the terms we use for different things. Okay. So that is the words given for the different way of learning, a different way of learning disabilities, and everyone must be knowing it. Okay, and the causes. Is the causes important in homeopathy? Yes. That is why the case taking comes in very important. A causes is AFM. So if you go into the Boric or any book or anything specific for this one, AFM becomes more important. If you get an ailment from, and if you don't get other symptoms, so predominant PQRS, then this becomes too important. Hereditary and genetics. Okay, hereditary and genetics. This is more important. That is why I've been telling you all this way to take the cases in a detail from the hereditary of the father, grandfather, or grandmother, or any other relatives, the very close people. So it runs in the family, and you can make the miasms. Okay, problems during pregnancy and birth. So this all has to come in the case taking. Does the mother had any problems during pregnancy or a birth? Okay, anomalies in development of brain, illness or the injury, fatal exposure to alcohol. Nowadays, mothers, alcoholism when they are pregnant is increasing, at least in Kerala. The socio-economic culture has changed. Social fabric of the society has changed. Previously, I've never seen, maybe around 10 or 15 years back, we never heard that female drinking, usual, casual also. But nowadays, it is on par with any male society, any males. Plus, alcoholism, depressions, and other things increases nowadays. So, alcoholism when the baby is in consumption is more. Low birth weight, oxygen depression, that cold or anything, the premature or prolonged labor. Okay. So these are the causes, very important. Accidents after birth, head injuries, malnutrition, toxic. Okay, dopamine and learning, all this. So, okay, that is, okay, signs and symptoms. Most of the signs are the problems in pronunciation words. That is what I said. How does he pronounce? Does he pronounce in a very quick way? Doesn't we don't understand? The pronunciation becomes too. We say it's pampering the kids. Also make the pronunciation bad. How does he pronounce the word? Is it because of the age factor, or does he? How does he react? If he correct, also does he register? Okay, trouble finding the right word. Okay, does he write or read it in a proper way? Does he talk the proper ways? Difficulty in rhyming. Okay, these are all the signs and symptoms. And why these are too important is, well, I'll tell you. Trouble learning alphabet, numbers, colors, shapes, days of week. Okay, we have to find out whether it's a laziness or he's not interested in learning, or it is he's not it is not possible for him to learn, or his IQ levels are very low, or he doesn't he cannot register, he cannot pronounce, he cannot understand following directions or something of that sort. Difficulty in controlling crayons. He cannot write because his neurons are having problems, or his nerves has any problems. We have to find out that. Does he able to balance? That is why cerebrum. Does he sit properly? How does he sit? All that has to be taken care in the cases of this one. It is not like treating a fever or treating any other things. It's little more difficult. It's not difficult. It's little more has to be learned. We have to give little more time. It is not that too difficult for the to treat learning disability. Pencil, scissors, all that. Trouble with buttons, zippers, learning. Kid doesn't even, because most of the time it doesn't forgets to zip. Okay, 5 to 9 years. Trouble learning the connection between the letters and sound. Okay, unable to blend sound to make the words. See, he cannot register. He cannot blend. He cannot words. He cannot say that A, B, C, D or and. He cannot pronounce properly. Confuse basic words when reading. So that is why I said case taking is little more difficult in this, because we also get confused whether the boy is confused or is he doing it purposely, or parents, whether the parents have taught him to pronounce something of that sort, because parents education is also more important. Okay, and the language problems, whether the kid is from the same language we can hear, or we where the if I'm a Keralite, whether the boy is studying in English, it's not easy, whether the boy is from some other part and adjusting here, all that has to be taken care. Difficulty telling time and remembering sequences, that is old memories, or today also what is the time, he doesn't know, he doesn't know how to check the time. Maybe he doesn't have a watch, or the parents have not taught him, so it's not easy to for him to recognize or when we ask. Okay, 10 to 13, difficulty with the reading and comprehension of math skills. So this things has to be given more important with the age of the patient. If the boy comes from 10 to 13 or 14 or 15 years side, then these are the things we have to give little more important. Other things has to be given important, but these are the things we have to give little more important. So age is also a factor. Okay, dislikes reading and writing, avoids reading loud, loud. Then we'll have to see that why. Okay, poor organization, bedrooms, he just comes and throws things. Laziness, he is not doing things. Trouble following classroom discussions and expressing the thought. Okay, all those things comes in. Developmental milestones, that is also more important. Milestones makes the things different. Okay, so all the developmental milestones of the patient is very important. Premature or the milestones have to be different, because our medicine also depends on that also. Paying attention to normal developmental milestone, that is also important. Types. can be categorized by the stage of information process, the function by function impaired. Okay. Huh. By which part is difficult? Whether he cannot take up the input we give it. Okay. So medicine changes depending on the stages of learning disability. Integration, whatever we say, patient has to register, brain has to do all the necessary grasping. Okay, whether the patient has a learning problem there or only on the input, so that becomes more important, right? Then the storage, this information has to go to the brain and store. And output comes in when all the analyzing part is over, then the output comes. Okay. So inputs have different things, difficulty with auditory perception, all kind of inputs. Integration, I don't have to tell you all this. This is a stage during which the perceived input is interpreted, categorized, placed in a sequence and related to. This all normal things happens to us. But in a learning disability kid, different stages have different problems. Okay. So this is the storage things. And output, you know, the different difficulties with language output, whether it's the English or the maths, it's all depends. Okay. Okay. By reading disorders with the writing expression, math disability, deficits. Okay, I'm not going detail about it. Reading disorder, dyslexia, all that is a dyslexia. Okay, reading disability can affect any part of the reading process. Difficulty with accurate or fluent word recognition, word decoding, all that is a part of the learning. Dyslexia before the term. Okay, that is all theory. Disorder written expressions. Okay, multiple spelling errors, poor paragraph organization. So disorder in spelling and handwriting with all that's a part of the so maths disability. I'm not going detail about the this ones. Okay. Speaking and listening, memory, social skills, executive functions such as organization skills and time management is not difficult. It's difficult. Common types of learning disability, dyslexia, dyscalculia, display that I have explained it to you. Difficulty in maths is dyscalculia, dyslexia, difficulty in reading, dysgraphias, difficulty in writing, problems with handwriting, spelling, organizing ideas. Dyspraxia is difficulty with the fine motor skills. Whether he can touch it, he can write it, he can hold the paper properly, he can hold the pen properly. Dysphasia or aphasia, difficulty with the language. Auditory processing disorder, visual processing disorders, all that parts comes in. So we don't have to go in too much of a theory part. We should know all this. Here I'm going through little faster because of this. Okay. So because ADHD, everything if you touch it, we will not end up today. So I'm going little faster. I'm just thinking about learning disability. Then if you have time, I'll go into the ADHD also. Okay. First, let's finish learning disability. Huh. So learning disability and ADHD can also come together. Okay. But not always, it's not compulsory, or every time you should have an ADHD or learning disability together. See, behavioral, inappropriate social interaction, poor eye contact, compulsive behavior, impulsivity. All that is also comes in. Developmental, I'm not going into. Okay. But this all becomes very important to learn. Okay, now get into the homeopathic approach. Okay, what I do in the clinic is these are the few approaches we go through. Homeopathic approaches, case taking. Case taking, I explained it to you. What all important in this case taking? Milestones are important. Hereditary factors are important. Does the kid has any other complaints, physical complaints or any other problems? That is also important. Parents history also important. Parents behavioral issues, parents alcoholism or any other things. So all that is that will come up in the case taking. Case taking, whether the kid sleeps, physical generals, mental generals, all becomes very important. Okay. Then the second approach is general management. In the general management depends upon the general management comes up little more difficult for me, because that's what I said first. We should be very patient enough. Doctor, if doesn't have a patience, don't ever bother to touch these cases. You can refer it to another homeopath, because how do I manage this? Once a patient goes from the clinic, once we give the medicine, and once the patient goes from the patient, I ask the parents and the boy, if he's old enough, to send to me all the writings, or what does it do it in the clinic, in the house, or how does he learn. I ask the kids parents to make him write 3 times a day, three questions 3 times, then repeat it, learn, and they should send the daily reports to me, whatever he has given, to through the WhatsApp. And after the WhatsApp, I ask them to call up. So what happens is, sometimes when the kid becomes, and we give them a positive stroke, we tell them, okay, without you are a good boy, you can do it. We feel all that small positive stroke. We ask them, what did you have? How is it? How the house is? So we know the kids doesn't. Most of the kids doesn't speak lies. So we know what is the situation at the home. So what did you eat? How are you? What is this? How did you keep your books? All the details you ask them in 5 to 10 minutes. So if you have 10 patients, 1 hour you have to, minimum 1 hour you have to keep it aside for the kids after our clinic time. It's not easy. Our family life also gets affected for a little. My kids ask them, you never asked us, did you study? Because my kids, fortunate, or I'm too fortunate, my kids have become too good in studies. I've never bothered. They have not bothered me in the matter of studies. Okay. So that way I was lucky. But usually when the phone starts up, my wife starts. You don't have time for us. You don't have time for this. You come from clinic only by 8:30 in the night. Then after this patient, this will come. So every day you have 10 or 15 or 12 or 10 or 15 patients. They call up every day. You have not even spoke to your kid whether you had your dinner. Now you are asking to someone. So all that is a part of the life. That is why I said you should have a lot of patience. You should have a lot of time for these kids. Otherwise, please don't spoil them also, your family life also, your patient's life also. Don't bother to take these cases. We are not like any allopathic doctor who just prescribes and leave the cases. No. And the results are very good. They get good marks. The kids become a good human being. They get good mentors through us. So general management is very important in the case of learning disability. And positive stroke. Always don't show your anger or your frustration or family issues or fights in the house. We are also human beings. At times we also get frustrated, a lot of issues frustrated for. So your frustrations, your things has to be set aside and talk to the kids in a proper way. If you are not in a mood to talk to the kids, tell them, okay, today I'm little busy, call up tomorrow. But make sure whatever he has sent it, when you have free time, to see through the WhatsApp and respond at least in the WhatsApp, so that they feel that okay, he is taking care of it. even though he is busy or doing something, he is attending. He is in for the doctor. My kid is important. My kid. That is the most important tagline for any patient or any parent or anything. My kid. That is their pride. So we have to make sure that we are their child is my child also. So my child is precious for me. Their child is too precious for him and for me also because they give me reputations. 10 marks increase, 1 mark increase, 2 mark increases. If he passes in one subject which he has not passed over the months or over the years, that will get you a laurel, that will give you more patience. Your name is going to grow. School will attend. School will know. His friends will know. His class will know. So if he shows some more important, more likely to get all the patients from all the kids from that class or school. So that also you have to be very careful. And my most important thing is mathematic approach. Mathematic approach is very important. I explained it to you in a much this way. Symptomatic treatment. Symptomatic treatment is important because you may get miasmatic approach at times, but you may will get only one sentence or one symptom or two symptoms or three symptoms, even after taking the so much of cases, because all this becomes crumpled. You don't get something. Whatever we are looking at, does this kid have a PQRS symptom so that I can prescribe on that symptom? You may not get. You may get. They don't know what is PQRS, so they may not tell you also. For that, if you start digging, then only the patients will that we will get it. Repertorial totality. Repertorial totality can go wrong, but whatever the symptoms corrected, that is another approach. Whatever we think that okay, he has a good set of symptoms. The parents have explained enough and more. So take the symptoms and convert it into rubrics. Okay, repertorial totality. I'm not going to explain it to you too much because I'm coming with the repertorial totality and constitutional medicines. If you get all the physical generals and mental generals, and then go for a constitutional treatment. So everything is important. If you get one symptom, that is also important in treating the case. Like any other disease, a fever, if you get a PQRS, that is more than enough to treat. If you get a PQRS here, that is also most important. If you don't get it, the approach has to be changed. If you get a prominent miasm and the other things are not to the doesn't have the 3 mark or 5 mark, then if miasm is prominent, the approach is anti-miasmatic and start the treatment. So depending on the symptoms or the whatever we have it in your hand, okay, your approach to the case differs. Now we will see. We will see with the each symptom. If you look into the repertory, you get if you take the anchor, these are the lot of medicines. You get all 5 mark medicine or 3 mark medicine, depending on the this one. If the anchor is there, then you have to specify what kind of anchor, so that 15 to 20 medicines of anchor get back to 2 or 3 medicines, and from there you can differentiate. Okay, he gets angry from contradictions from Oramet, Sepia. These are the few medicines it comes in. Okay, and how will you differentiate from this? You know Ignatia mind, you know what is Oramet mind, depression, and gets into the this one. So if the patient is showing what the totality, if the patient is showing Oramet mind coming to suicide or it gets worried and he goes into the depression, then plus contradictions from, then go for the Oramet. Same way with the Ignatia. If he is broods, if he is depressed, if he like anatomy keeps on coding, Ignatia mind if we get it. Along with that, Ignatia contradiction from. Like also, you know. Same way, differentiated. throws things away, anchor, and he just throws. The only medicine comes up is staphysagria most of the time. Take, and once if we get into repertorization, single medicine, that becomes more important. Touch to one. We have the arnica, but arnica, it doesn't allow that to touch, but if touch to one gets angry, but it is in a physical state. Touch to one, tarantula, most prominent medicine. And if he gets anchor with trampling, aurum met and nitric acid, he gets trampling. And violent, violency of aconite, violency of aurum, chamomilla kit, you know. I don't have to explain too much of the chamomilla kit. Heppas are very sensitive for slight mental and physical. Hepasal sensitivity is more than chamomilla in physical as well as mind. He gets into the shell. Kali Carb, same. Okay, sensitive mind and sensitive physic. Even the it is said that even the small cold makes the patient angry or violent. Nitric acid, Nexomica, again Staphysagria, Tarantula. You know that violence of Tarantula runs around, doesn't sit, he doesn't like to learn, he becomes very violent. Okay, mind breaks things desire to. He feels like breaking things. Okay, Stramonium. Epis also has that this one. But if you don't get other symptoms, then you take this as an important symptoms. If you take the other symptoms, take out the totality and add this into repertoire totality, you get these medicines. Okay. So tears things. Belladonna. No other medicine have that anchor and feel like tearing things. He tears things. He picks up the Kent has written the picks up the bed sheets. That is clearly it is written. Okay. Mind throws things. Throws things away. I told you Staphysagria. Mind violent. Mind violent. Physical, this is not the mind violent. You get aurum, belladonna, cicuta, nexomica, stramonium, all that becomes a violent medicines only. You know that. Details I've told you, this is how we differentiate. You take this one symptom, plus you add up the other things if you have physical symptoms, mental symptoms, then if you have a constitution medicine. But if this makes the things more important, then go for it. Okay, mind answers. This becomes very easy when you ask questions. The patient will tell you, or the patient will talk to you in this way, or the parents will tell you. This is how the kids speaks abruptly, shortly and curtly. He just talks one sentence, abrupt. But doesn't know what is he talking. So these are the medicines coming up. Aversion to talk. 3 medicines. Glonoin, we never think. Hyoscyamus added with lot of other things. Okay, religious mania, or the kid doesn't like to dress. Lot of things comes up with hyoscyamus is one of the best medicine for learning disability as well as ADHD. Nexomica, mind, arrogance. He doesn't bother about what others think. He doesn't mingle. He feels that I am the best. Okay, that is how we have to differentiate things. Aversion to loquacious at other times. Aversion to aversion to singing, talking, but will not answer questions. He sings, talks, all that, but if you ask questions, he doesn't reply. Agaricus, confusedly. So every symptoms, foolish. We know that patient doesn't talk. We first thing is Barretta. We think about Barretta cup when he talks foolishly. When the child always keeps on smiling or laughing or smiles. When we ask questions, also smiles. Otherwise, also he smiles. We think, why is he doing it? When we ask question, if he doesn't answer it properly, or instead of answering, he just smiles. So Baraita is one medicine, another one medicine. Arsenic alk, belladonna. Belladonna, this one is mind, congestive mind, because he keeps thinking in a different way. He gets violent. Okay, foolish. So he doesn't know what is it talking about. His answers very quick, but maybe wrong, might be right. So once he starts talking faster, lycopodium comes in. Imaginary questions. He asks some imaginary question where we don't know the answers. What will happen if the sky comes down? Can you imagine anything? Can you answer anything? So those are the things we have to understand. Don't think that all these symptoms are difficult to elicit or it is difficult to come. It is very easy. Okay. Answers incoherently. Coffea. Okay. Cholesterol. Cannabis indica. Cannabis indica. Cannabis indica medicine itself is a uh, what is that medicine? It is a what is that? It's a narcotic. So the symptoms of that medicine, it's a what we say is doctrine of signature. Use that here. Cyclamen are also incoherent speech is there. Okay, irrelevant. Phosphorus and sulfur. Phosphorus is one of the best medicine for even learning disability. It has a gray matter effect is a soft tissue. Phosphorus affects on the brains. Okay, refuses to answer. Again, phosphorus. Irrelevantly is there. Refuses to talk. Sulfur. Sulfur is a rag. We know that the kid doesn't take care of himself. All that is the rag of because of kind of stuff. So he doesn't answer. Slowly, mercury poisoning. You just imagine that. So once the mercury slow poisoning comes up, all the brain and other things become weak. Same way, all the parameters go slow. So slow speech. Phosphoric acid. Again, phosphorus. The phosphorus comes in many. You take up the repertory. Phosphorus has a better scope in the case of learning disability. Stupor returns quickly after. Hyoscyamus. Okay. Childish behavior. Baretta cup and cicuta. Cicuta is one of the best medicine if the 10-year-old kid comes and behaves like a 7-year-old or 8-year-old or 6-year-old. So we have to differentiate from mental retardation or IQ low or the brain damage, anything of that sort. Okay. If the parents tell that the kid doesn't like company, so we know all the medicines doesn't. But the problem with this is we cannot even take just one symptom as it is. We if it doesn't have too much of symptoms and this becomes too prominent,
Hello,
we feel
hello,
yes,
doctor. How many slides remaining?
slides are 150.
I, so we can stop the session here and then we can have a short discussion and then we can have a second part of the same. If you are ready on 18th itself.
18th, yeah,
Okay.
I'll just check it out and tell you.
Okay. We can just conclude the session for the time being.
Huh.
It seemed to be a big subject and a big, your presentation seemed to be a big one, giving all part of the learning disability.
This is 80, 91. Another 50 slides are there.
Okay, definitely we can fix another date if possible on 18th because that date is very available
15.
now.
Today is 16, no, sir? 15.
Today it is 15th. That is
It,
coming Tuesday. Coming Tuesday.
huh, we will see, sir.
Okay. Uh,
Okay.
let us pause there. Okay. I shall replace this. Yes. as we all know that this is a wide subject, and the scope is very, very high as far as homeopathy is concerned, and we can do lot of wonders. Most of the doctors are getting such cases, and even in our department of homeopathy department in Kerala has such a system to treat school children, and doctors visit in schools and they find out which are the children who are really in need of the situation face this kind of problem, and they are advised to visit our hospitals and government sector itself so that they can give free treatment for all these things. And even private doctors around here get lot of such cases, and homeopathy giving lot of wonders in such cases. Congratulations, Dr. Sadat Sait, for such a beautiful session in this evening. And it is a time for a short time for discussion of the 3 minutes. I invite Dr. Indrani Pavakar to say a few words.
Yeah. So thank you for the lecture. As a homeopath, only some common questions trouble us a lot in ADHD cases. Can you guide us for that? Number one is, can adults get ADHD? And what are the
Yes.
criteria to diagnose ADHD?
Criteria to there's nothing something ADHD can be diagnosed at any age.
Any age. Okay.
Any
So
age.
no age limit is there. Okay.
No age limit is there.
Okay.
Two, what are the criteria to diagnosis depending on the age factors? So we
Okay.
cannot take the child things in when he is 50 because the symptoms changes. But
Yeah,
all
correct.
the case taking factors are the same.
Same.
Everything is same.
Okay. And sir, are there any co-occurring conditions like anxiety, fears, and phobia that could affect ADHD?
Yes, that is what the thing is. So we have to differentiate whether the patient is phobia patient, is a
But will it
psycho.
ADHD will it affect? This is a co-occurring thing, phobia, anxiety. Then
Anxiety always will be there with the ADHD.
yeah,
Uh, uh,
but will they affect the ADHD condition? Like
yes,
increasing
yes,
acute.
it will definitely increase the issues,
Oh,
ADHD, because the
okay.
patient see what happens is ADHD once he gets it, he gets a low mark or attention is different difficult. So he is worried about the teacher, mother, father if they are very strict. So automatically he will start developing anxieties, and this could go little further when he has a trait of a psychiatric anxiety disorders.
Okay, sir. Are
Yeah,
there any acute remedies for acute exacerbation of ADHD?
yes, that also depends upon the symptom presented at that time.
Okay, okay, okay. So
So we have
acute
to
symptom.
take, yeah, presented at that time. That particular time, what is the symptoms predominant? We have to take that and treat.
Okay. Thank you, sir. You have answered the
Oh,
query well. I thank you for the same.
thank you, sir.
Now I invite Dr. Manoj to say vote of thanks to the session, as the time is just 1 minute
Yes,
remaining.
thank you, Dr. Tanesh. Of course, we all know that he's a person with a lot of skill and knowledge, as well as is always willing to present each and every topic as required by IFPH. That's the most important thing. So on behalf of IFPH, I am expressing sincere thanks to Dr. Sadat Said and all those participated in the English session. Thank you.
Thank you, sir.
Thank you, Dr. Manoj, Dr. Sadasir, Dr. All doctors and homeopathic lovers who attended the session. And tomorrow we will have a session from Dr. Professor Paul Joseph from Canada, and Dr. will be talking about unleash the healing artist inside the patient. So another big session coming up tomorrow. At the same time, all of you can join by using the same link that we shared today. Hope all of you enjoy the session. Thank you all. Good night. It's over to Dr. Vishaila to moderate the Malayalam session.